Too. Let me ask you this. One of the most beneficial components of the Affordable Care Act was the expansion of the Medicaid program that resulted in 11 million people nationwide and over 500,000 in New Jersey gaining coverage, many for the first time. It's one of the biggest programs on the Republican chopping block, with proposals to not only repeal the Affordable Care's Medicaid expansion, but going further and cutting billions in federal funding to the states. There's no doubt that this would result in catastrophic loss of coverage for tens of millions of low-income families and lead to tens of billions in losses to safety net and other health care providers. Do you recognize Medicaid to be a valuable program and consider the coverage it provides to 74 million Americans to be comprehensive?
Medicaid is a vital program for health care for many individuals in this country, but one that has significant challenges. There's 1 out of every 3 physicians who should be seeing Medicaid patients who are not taking any Medicaid patients. There's a reason for that. If we're honest with ourselves, we would be asking the question, why?
Well, if that's the case, that 1 in 3 don't treat Medicaid, you have to ask yourself, is that because Medicaid reimbursements are so low? And since provider reimbursements are set at a state level, won't cutting federal funding and hitting states with higher costs only lead to lower provider rates? And how many doctors would actually treat former Medicaid beneficiaries when they no longer have any coverage or ability to pay? So even if there's only 1 of 3, there's still 2 of 3 that are providing the services. Imagine if you don't have coverage, which goes to my next question. You have advocated to, in essence, block grant Medicaid. Now, the essence of Medicaid is an entitlement, which under the law means if I meet these criteria, I have the right to have that coverage under the law. When you move to a block grant, you remove the right and you make it a possibility, subject to whatever funding there's going to be. Do you recognize that in doing so, you risk the potential of millions of Americans who presently enjoy health care coverage through Medicaid no longer having that right?
I think that it's important to appreciate that no system that the President has supported or that I have supported would leave anybody without the opportunity to gain coverage. Nobody.
Well, that's not my question, so let me reiterate my question. Medicaid, under the law as it exists today, is a right. Is that not the case, yes or no?
It's an entitlement program.
And as an entitlement, doesn't that mean you have the right, if you meet the criteria, that you are entitled to the services of that program?
One is eligible, that's correct.
One is eligible, meaning you have a right. When you move to a block grant, do you still have the right? No.
I think it would be determined by how that was set up, if in fact that was what Congress did. Again, the role of the Department of Health and Human Services is to administer the laws that you pass.
Yeah, but I would just simply say to you, I know in our private conversation, I appreciate you coming by to visit me, you suggested that your role is that of an administrator of a large department. Well, that's not even what the Vice President said when you were nominated. He said he expected your experience both medically and legislatively to help drive policy, and even beyond the expectations of the Vice President in that regard, when we have regulatory abilities of the Secretary to dictate regulation, that is policy. So please don't say to me that I am here just to do what Congress says. I respect that you will follow the law and do whatever Congress says, but you will have an enormous impact. And based upon your previous opinions, as it relates to Medicaid, ultimately, block granting means a loss of a right. And then it's just a question of funding, and then we'll have a bigger problem with the number of providers willing provided. So I hope we can get to a better understanding of your commitment to Medicaid as it is as an entitlement, as a right.
Thank you, sir.